The fight over expanding Medicaid has gotten ugly, and the latest state to grab the spotlight is Mississippi, where a standoff in the legislature is pushing the state toward a cliff. Without a last-minute agreement, Medicaid may cease altogether on July 1st. Our guest via Skype is Democratic State Representative Robert Johnson of Natchez, Mississippi. Also in Madison, Mississippi is Shannon, Director of Advocacy and Communication for the Mississippi Hospital Association. Thank you both for taking some time with us. We do appreciate it. If you will, Shannon, just sit tight for just a second. Mr. Johnson, I want to start with you. Correct me if I'm wrong. As I understand it, you all are in this situation because state law requires the legislature to reauthorize Medicaid annually, but the Democrats in the House rejected the reauthorization bill because Republicans would not allow a debate on expanding Medicaid. Is that right so far?
That's correct.
Okay. And of course, without this bill passing, it could affect, what they wanted to expand it to include another 300,000 people. So I guess my question is this. This sounds like politics to me. And I guess I am wondering, how is it possible to play politics with the lives and the health of people who so desperately need these services, particularly the poor and even the indigent?
Well, you're exactly right. You shouldn't play politics with those issues, and that's not what we're doing. What we have a Republican governor, we have a Republican lieutenant governor, Republican House Speaker, Republican control both houses. I don't understand, and Democrats don't understand why there won't be an open debate about an issue that affects 300,000 Mississippians who don't have health care. We have hospitals. We have a law that's been passed here in this state, and hospitals that may close, may discontinue services to a population of people who are the poorest in the country, who have some of the worst health outcomes in the country. We have the highest unemployment rate in the country. All we're trying to do is make sure that we do the best we can for the people of the state of Mississippi. Now, this whole idea that the Democrats are shutting down Medicaid or that we're playing politics, I think it's an argument that should be had. But the issue is this: how can we shut down an agency that's controlled by the governor who doesn't want to talk about expansion, a legislature that's controlled by a speaker that doesn't want to talk about expansion, and a Senate that's controlled by a lieutenant governor that doesn't want to talk about expansion? Expansion that affects 300,000 Mississippians.
Okay, so sit tight there for just a second, Mr. Johnson. Let me bring Shannon into this discussion. If, in fact, this bill expires on June 30th, which means that these cuts would be made July 1st, what's the real-world actual effect to health care?
Well, of course, our hospitals are concerned a little bit about, obviously, we want to make sure that the current role is covered. So we have approximately 700,000 individuals right now on the Medicaid rolls, and we want to make sure that those individuals are covered too. So, of course, we also want to make sure that we can have coverage for as many lives as possible. Hospitals are about caring and providing services, and we want to make sure that we can continue to do those things.
And that's very noble, but this also affects the running of the hospitals and the staffing of the hospitals as well, does it not?
It does. The real issue is, well, there are two. The first is hospitals have a very high uncompensated care costs in Mississippi, particularly. That's one of our largest issues, and that basically happens when low-income individuals come into our hospitals, and we see the patients. A lot of times they get to the ER before they, and they're in critical or advanced condition, and their bills are submounting, and so they can't pay, and the hospitals end up eating those costs. So that's a huge issue for us. The secondary issue with this particular situation is that the health care reform law is in place, and that includes cuts to hospitals. Mm-hmm. And so we are getting the cuts, and and you can do the math. The equation is unbalanced there if we don't increase the rolls and expand Medicaid.
Sure, sure. Robert, let me come back to you. It seems to me that both the Democrats and the Republicans sort of continue this debate at their own peril. I understand about a decade ago, then Governor Haley Barbour backed a Medicaid reform bill that resulted in 65,000 elderly and disabled people being dropped from the rolls. It created a public outcry that really damaged his approval ratings. I wonder who's going to be hurt the worst, beside the people who are losing these services, the Democrats or the Republicans, if this all goes down.
Well, let me say this. I don't think the agency is going to shut down. I think we're going to get to an understanding. I think cooler heads will prevail. But look, who will be blamed or who will have the negative effect other than the people who are receiving the services? I think it's going to be the governor. The governor has it is his agency. He appoints the director. He runs the agency after the authorization by the legislature, and he has the authority to call a special session. Look, we just differ in what we think that the outcomes ought to be. They think that if we just reauthorize Medicaid and leave it alone, everything will be hunky-dory. We think if you don't do something about expansion, if you don't recognize that the Affordable Care Act is a law of the land, you're going to end up actually hurting the Medicaid program and putting the services that are provided to our population is going to be severely hurt, and in some places irreparably hurt. And so we just can't. We don't think that. We think it's very callous to not recognize that there's going to be $20 billion cut out of the DISH program, and we're a state that is very DISH heavy. And until we do something about that, until we face what the federal law says, then we are putting all of our people in the state of Mississippi in great peril.
Well, as you correctly said, let's hope cooler heads do indeed prevail. Representative Robert Johnson as well as Shannon Coker, we thank you both for being with us.
Thank you.